Pleased to welcome back to the program, wearing a different hat this time, Dr. Robbie Goldstein, infectious disease specialist at Mass General Hospital, to chat about this exciting news, Doctor, of coronavirus vaccines now. How are you?
I am doing well. I'm happy to be back on the program.
It's really a pleasure to be able to talk to you about your specialty and about your life's work. Obviously, there was the campaign for the 8th Congressional District that we first met, but I said to myself, gosh, I now know an infectious disease specialist. Who better to talk to about a vaccine for the pandemic? So I really do appreciate your time.
Yes, absolutely. Happy to do so. Although I think you might hear some of the same themes that I talked about during the campaign when we talk in particular about this vaccine and equitable distribution of the vaccine.
I remember that was a major campaign platform for you. Was your concern about the disparity, about how the pandemic is affecting people of color, and now I know you're concerned about how vaccinations will also have that similar impact, right?
Yes, yeah, absolutely. And I think maybe I don't want to take the interview too much from you, but maybe we should start just with the basics of where we stand right now with this vaccine and with knowledge of new vaccines that are about to come on the market as well.
Yeah, please do. First of all, tell us what you know about these two different vaccines, if you could.
Yeah. So, I think we are all caught up in the news right now about two vaccines in particular. One that was manufactured by Pfizer here in the United States and a German company, and another manufactured by Moderna, which has ties here to Massachusetts. And both of these vaccines are working their way through rather quickly the FDA authorization process. And in a bit of a coincidence, actually, both vaccines are quite similar. They're a new type of vaccine that has been developed over the past few years, and this is the first time that we're able to really roll it out in this clinical space. It's a vaccine that you'll hear about called an mRNA vaccine. Basically, the idea is that we use this vaccine to harness our own cells, our own body's cells, to create protein that looks like COVID-19. It looks like the virus that causes COVID-19. And when we create those proteins, our body's immune system responds, and we create that immune response we need so that we can prevent COVID-19 infection in the future. So the two vaccines were developed in different labs by different companies, but very much went through this process side by side, and both entered into clinical trials pretty early on in the process, made their way through our safety trials, which are phase 1, through a larger scale efficacy and safety trial that's phase 2, and both completed phase 3 trials about a month ago when we got that first readout on were these effective vaccines for COVID-19. And I think all of us were thrilled and excited to see that, yes, they were effective and quite effective, about 95% effective, which is on par with vaccines that we use for things like measles and chickenpox and other childhood illnesses that we've been vaccinated against. So it created a lot of excitement in medicine and in science, and obviously a lot of excitement at the Food and Drug Administration, which has gone on to authorize the Pfizer vaccine, and appears poised to authorize the second, the Moderna vaccine, later this week.
So the obvious question is, do you feel that these vaccines are safe?
So we have a tremendous amount of data that shows that the vaccines are safe. We have study participants who were part of phase 1, those early safety trials that tolerated the vaccines quite well, that have now been exposed to that vaccine for many, many months, and we have long-term follow-up data on them. We also know from the phase 3 studies that enrolled close to 40,000 people in each of the studies, that these vaccines are very, very safe when we distribute them in a widespread manner to thousands and thousands of people. They have side effects. All vaccines have side effects, but the side effects seem to be consistent with what we would expect for a vaccine. Things like muscle aches, maybe low-grade fevers, some fatigue, things that we would expect anytime you might get a vaccine.
So did these trials occur quicker than they normally would in a non-pandemic situation?
They certainly happened in a really rapid pace. And there were a couple of reasons why these could happen so fast. One of the reasons they could happen so fast is that infections remained really high all throughout the pandemic, right? And so here in the United States, we never really saw the dramatic drop in daily infections. And so the rates of post-vaccination infections were high enough that we got enough data points that we could end the trial. No, I wasn't part of the trial, I shouldn't say we, but medicine and science could end the trial rather quickly after 2 months and actually have a significant outcome. So that was one reason why it happened pretty fast. The second reason is that we spent a lot of money to get these vaccines to market and to get them ready, because we should. This is a public health crisis, a global public health crisis, and it is incumbent upon all of us to do what we can to end it. And so we backed these vaccines and these trials with significant investment from the federal government and other governments that allowed us to move forward pretty quickly, and it allowed us to get these to market. The pace has nothing to do with whether or not they were done in a way outside of what we would do in science. Everything was done to the T, everything was checked and monitored appropriately. I have full faith in the structure of the vaccine trials.
Will you get the vaccine, doctor?
I will. So here I'm at Mass General, and here at the hospital, we have a phased approach of delivering the vaccine to our employees based on our overall exposure to patients in the hospital. When my wave is called, I will sign up to get the vaccine and will be part of the workforce here that gets the vaccine. I think it is really important that we in healthcare lead with our actions and show people our belief in these vaccines, in our knowledge that these are safe and efficacious.
When can folks expect, the vaccine to have such an impact that there's no longer a pandemic?
Yeah, so that's a hard question to answer. That is dependent upon a number of things. So one is how quickly can we get the vaccine out there to as many people as possible? To get us to what we consider to be herd immunity, or that point when enough people are vaccinated that there's limited spread of the virus between people, we need to get to around 60% of people vaccinated. That's going to take us a while. We have 360 million people here in the United States. It's going to take a long time to get through over 150 million vaccinations. We have to remember, though, that as people have often been saying recently, vaccines don't save lives, vaccinations save lives. And so it's important to push for that to happen. So that's the first thing that's going to dictate our timeline. The second thing is that, we have to make sure that the vaccine distribution happens equitably across our society. So if we get to 60% by only vaccinating small portions of our society, it means that large portions are still going to be at risk. And we're not going to be able to take our mask off. We're not going to be able to go back to what we had, just 12 months ago in December of 2019, when we were all out and about on the streets. So we've got to work really hard to get as many people vaccinated across the widest possible spectrum of our society so that we can get back to that place where we all feel safe.
As I understand it, initial kind of surveys of the minority communities indicate that they're very skeptical and very hesitant to get this vaccine. Does that surprise you, and does that concern you?
It certainly concerns me. It doesn't surprise me. So, vaccine hesitancy is something that has existed for a very, very long time, and for different reasons, depending on who you are and what community you come from. But in particular, in the Black community, there's been a lot of skepticism around vaccines that dates back to decades of mistrust of the medical system because of stigma and discrimination and poor practices of the medical community towards the Black community. So it is fully founded in reality and in a true history. But because of that, right, the Black community has said that only about 40% of folks in the Black community are willing right now to take the vaccine. And that's very worrisome. This is a community that was hard hit by the pandemic, continues to be hit with increasing numbers of cases and deaths. And it's a community that would benefit tremendously from the vaccine. And we have a lot of work to do in medicine, in public health, in government, to build faith and trust with the Black community so that they do accept this vaccine and we can move towards the end of this pandemic.
Are there people that should not get the vaccine, doctor, if they have pre-existing conditions, perhaps, or things of that nature?
We don't know a lot about who may not do well with the vaccine yet. I think we're going to learn more as we vaccinate individuals, certainly in the healthcare space and others. What I can say is that, for instance, the Pfizer vaccine was only studied in people who were 16 years of age and older. And so we don't yet know if kids should receive the vaccine, and it's not part of the authorization to give children the vaccine. We also know that all of the vaccine trials to date have excluded pregnant women. And that gives us in medicine a little bit of pause about whether or not we should offer this vaccine to pregnant women, and whether there's a risk to giving the vaccine to pregnant women. I think that we're going to learn some more information. There are active attempts to enroll pregnant women in clinical trials and to understand the safety. But for right now, those are two big groups, children and pregnant women, where we don't have data, and everyone's feeling a little bit cautious about whether we should roll the vaccine out for them.
Yeah. Do we know how long the vaccine is effective? Is this something that we'll have to get every year like the flu shot?
Yeah, that's another thing we don't know for sure. The reality is that nobody on this entire planet had this virus a year ago today. And we are now at a place where we have not only millions of people who have been infected and over 300,000 Americans who have died from the virus, right? But now we have the first group of people who are getting the vaccine. And so we've got to pull a lot of those data together and watch them very closely over time to get a sense of what happens to your immune system. Do you remain immune to this virus 6 months later, 12 months later, 4 years later? And what happens to the virus? Does the virus mutate and change in a way that may make it necessary to get another vaccine in the future? There's more to come, but I think we should all be in many ways impressed by how quickly we obtained the information this year and how we can continue to do that in the years to come.
If someone has had COVID-19 and recovered from it, do they need to get a vaccine?
They should get a vaccine. I'm not going to avoid the question of do they need to get a vaccine, but they should get a vaccine. So those individuals were included in the clinical trials, people who had previously had COVID-19. And this vaccine is effective in those. We do know that people can get infected multiple times. And so it is beneficial for folks who have had COVID in the past to still take the COVID vaccine going forward.
Okay. What are the differences between the Moderna and the Pfizer vaccines, and are they significant?
Yeah, so not really. If I was maybe on the board of Moderna or working in the lab at Pfizer, I might say they're completely different. But from our perspective, I think we should acknowledge that they're very similar vaccines. They use the same mechanism to induce immunity or induce that response to the virus. And in the rollout of vaccines, certainly in the early stages of the rollout of the vaccines, people are going to be offered a vaccine, but not offered necessarily the choice between Moderna or Pfizer, because we think that they're going to be pretty equivalent, and you'll kind of get what is most available locally for you. There are other vaccines that are coming down the pipeline. There are vaccines from Johnson & Johnson that are moving out of their phase 3 trial, and we're about to see data from them. Vaccines from companies here around Massachusetts that are using different technology to induce that immune response. And then there may be some differences of who benefits from one versus the other when we start to see those results. But for right now, we think of them as mostly equivalent.
As I understand it, that the two that are currently winning approval require a 2-dose vaccination. Is that right?
It is. So they both require an initial dose that does induce some immune response. People do have some protection from the first dose. And then a second dose 3 to 4 weeks later that really brings you up to that 95% efficacy of the vaccine. And so, I talked about earlier, right? We got 360 million people. We've got to get to 60% of those people vaccinated. That means we have to get 60% of those 360 million through twice, not just one, but 2 vaccines. So it's a heavy lift for public health to do this, but I think we are positioning ourselves to have the right system in place.
What's the situation at where you are at Mass General right now when it comes to COVID, Doctor?
So we're seeing, as we're seeing sort of across the state, increasing numbers of our inpatients, admitted individuals who are COVID positive. Um, those are folks both who come to the hospital because of symptoms of COVID, shortness of breath, cough, fevers, and also people who are coming to the hospital for other reasons, but we're diagnosing COVID when they show up into our emergency room because we're swabbing individuals. We've seen pretty steady increases week after week over the past month of folks both admitted to the hospital and in our ICUs.
No, I'm sorry, go ahead.
I was going to say, we're not at the point where we were last April or May, where we've had to expand our ICU capacity, but this is a daily moving target of us trying to figure out how many people are here and what resources we need for those individuals.
Yeah, that's what I was going to ask. We've seen, some of the field hospitals go up in other parts of the state and other parts of the country, even in parking lots of hospitals. Unfortunately, so you're not there at Mass General right now.
We're not there now. As I said, this is something that's being monitored closely every day by a team of folks who are looking at not just our own numbers, but numbers from communities around Mass General, so that we get a sense of what might be coming in our doors. We're all, I would say, anxious is maybe an understatement about what will happen over the next few weeks, given the holidays, the weather changing, restrictions on being outside because of the weather and what's happening in indoor spaces. We are anxious about an uptick in numbers that may happen.
Yeah, we've heard too about the tremendous toll taken on healthcare workers such as yourself, both emotionally and physically, because of this. Are you seeing that with yourself and your colleagues?
I think I'm very lucky to work at Mass General and to have such generous and supportive colleagues that I get to work with. We have a lot of resources in place for everyone who walks in these doors every day to make sure that they have what they need. But I think we're all recognizing that this has been a long year. It has been a very, very long 9 months of fighting this virus and showing up and sometimes not knowing what work may look like that day. That's hard. It's emotionally tolling, it's physically tolling, and I think we're all looking forward to 2021 and what the vaccine may bring.
Yeah. What did you take from the campaign trail, Doctor, that has aided you in your role at Mass General?
A tremendous amount.
Yeah.
I carried with me from the hospital to the campaign and from the campaign back to the hospital. But I think it was really helpful for me to get out there, especially during this pandemic, and talk with folks about things that they're struggling with. And to recognize how devastating this pandemic has been, and to bring that with me as I see patients every day here at the hospital, and to know that in some ways, in one individual appointment, in one inpatient stay, I'm just scratching the surface of what's going on in individuals' lives, and there's a lot of work that needs to be done to make sure that people are healthy and cared for.
Yeah. Do you feel that you're in a position now as a healthcare provider, really, a groundbreaking shift in the paradigm of the way ailments are treated?
Things have changed. I will say I was in clinic this morning. I put that in quotes because I sat in this chair in front of this computer screen and met with patients in a virtual way. That a year ago would never have been on my mind as something that we could possibly do. I think that we have innovated in remarkable ways in healthcare over the past 12 months, and I would love to see us continue to push that forward and to innovate even more. I think it allows us to provide more equitable care in many ways. We can reach more patients, we can reach them where they are, and we can begin to lower some of those barriers to get into care. But I think healthcare also has been almost every month kind of twisting and turning and changing and moving and responding to this pandemic. We're also looking for a little bit of stability in 2021. It might be nice to go back to when you go see a patient, it feels the same every day, as opposed to some of the shifts that we have to go through each day.
Are there other mRNA vaccines? And where does the future go for this type of technology?
Well, I think that the future is actually quite bright now for mRNA vaccines. I think, a year ago, people were talking about it as a potential tool in vaccination. We now know that it works, and I think we'll see over the next decade probably a whole slew of mRNA vaccines that come out for a whole wide number of probably viruses that we may be susceptible to. You know, I don't want to speculate. I'm not a vaccine developer. I'm not an immunologist. I'm an infectious disease doctor. But you could see how this type of vaccine could be helpful to think about our yearly flu shot, to think about things like Ebola and other pandemics we may be concerned about in the future. When we think about HIV and a vaccine for HIV, there are a lot of opportunities. And we've now shown that the vaccine can be incredibly safe and incredibly effective.
So it's, I mean, fair to say we're living in a ground-changing moment in medical care.
We are.
Anything else you'd like to share right now, Doctor?
No, I think maybe the one thing I'll say is I'll reiterate once again, this is a safe vaccine. This is an effective vaccine. And this is a vaccine that will move us towards the end of this pandemic if we all do this together. And so I'm encouraging everyone to get out there and to take the vaccine when the public health structure says it's time for you to get the vaccine.
Appreciate the opportunity to talk to you, really. And please reach out here if we can be of any help to get information to the community. We'd be happy to do that.
Absolutely. Thank you so much for having me back on.
You're very welcome. Be well.